Welcome everyone to this webinar about how AI is turning fax into an interoperability tool. Hope you will enjoy the discussion, and let's get started. So quick introduction, my name is Daniel. I'm the Chief Digital Officer for Prosecution, and I am a member of Digital Health Canada Chief. Joining me today is Roger Mack. He is our VP of Public Sector and Healthcare Solutions at Prosecution, and he is on the Technation Health Interoperability and Standards Committee. We have a special guest, one of our customers from New Brunswick, from Horizon Health, Ryan Dugan, who is the Director of Medical Imaging at Horizon Health. So before we start, just a quick information about Prosecution. We are a built in Canada SaaS platform that are highly secure and compliant. Our solutions were designed originally for the Ontario government. We are ISO standard certified, SOC 2, HIPAA, PHIR compliance, Go IT standards compliance. We have a platform that's able to transform unstructured data into structured content, and then basically based on standards such as HR7, FHIR, and Smart FHIR for the healthcare side to achieve interoperability. Our guest from Horizon Health, I'm just doing on behalf of Ryan. Horizon Health is based out of New Brunswick, population about 850,000 people, and they're the only province that are truly bilingual in Canada. Horizon represents the English health authority there, and Vitality, the French health authority. So there are two health authority there. So Horizon is divided into 4 zones with about 12 hospitals and about 100 medical facilities. They have a diverse, different version of Meditech and Allscript in the province right now. And there's a lot of talk about what they are going into a provincial clinical information systems. No one knows what it is yet, so we are all waiting to see what that provincial information system looks like. And the project we had with Horizon is a digital intake referral, a central intake for all the diagnostic imaging referrals for the province. Most of them are fax-based. Approximately $650,000 to $700,000, 700,000 referrals per year. So that's a little bit about Prosecution and Horizon Health. So both Roger, Ryan, and I, we just got back from Halifax at the eHealth 26 conference. We had a good time. We work hard, we play hard in Halifax. And I take a look at this year, the eHealth 26 conference is co-hosted actually by, or co-sponsored by Digital Health Canada, CIHI, and Canada Health Infoway. And I take a look at their mission is digital, connected, and accessible healthcare for all. So basically, they are grouping all the professional, all the thought leader, all the technology leaders, healthcare leaders in a conference to talk about how to get to this digital connected healthcare world from where we are today. And HIMSS Eastern Canada chapter is also coming out in November. So I take a look at the HIMSS mandate. So HIMSS mission is to reform the global health ecosystem through the power of information and technology. So very similar. So I want to open up the first question I have to Ryan and to Roger is basically, what are you seeing at eHealth 26 that excited you?
Mm-hmm.
I'll start with you, Roger.
Oh, for sure. Well, every time I go to a conference, like a healthcare conference, it's always good to listen to the industry partners or industry leaders about the challenge they're facing, the solutions they have, and the progress they're making. Now, in previous few years, there was a big emphasis on AI scribe, and this year, they got toned down. I hear more about practical solutions, the practical challenges about managing the referral intake, about the success and the failures as well. So I'm always excited to hear the up-to-date progress about some of the projects our partners are doing.
And Ryan?
Yeah, it was a great conference. I attended a lot of sessions focused on referrals as well, but the general vibe of the conference was interoperability. So where primary care meets intake for health systems for things like imaging, and wanting more seamless connectivity of those systems. And then also something that was surprising that I haven't heard before in a conference was really calling out vendors who aren't keeping their systems current. A lot of people are frustrated. We have lots of digital systems in the world. We've had digital systems for 20 years, and the systems some of them have stayed the same for 20 years. And the frustration that a lot of customers are feeling where they buy a solution and don't see it grow with them as the healthcare system evolves. So that was a really interesting takeaway, was frustration starting to build with digital solutions stuck in a time in the past.
Interesting observation.
Yes, and for me, I'm privileged to join the chief forum. So there's a debate about whether the priority should go into the health data infrastructure first, prioritizing it over a clinical AI application. That was an interesting debate, and always great to meet up with, for some of you from Quebec, Dr. Justin Cross from Juris General about the Made in Canada solution, EHR solution, away from the Quebec Epic deployment. That was interesting. So let's get into our conversation today about fax interoperability. So this topic actually came out from a report that was published by Amplify Care. So it was a joint publication with Hamilton Health Sciences and some other people. So basically, they are looking at a unique way to, at that time, everyone talked about axing the fax, right? In the 22, 23, in Ontario, our premier is really adamant about axing the fax. So they published this report with a clinical study with Southwestern Ontario about referral that are fax-based and digital-based, right? For the digital-based, they were referring to Ocean. So basically, the conclusion of this project is that the project demonstrates the potential of having a business automation workflow platform that bridge the gap between fax and e-referral systems, right? So the system minimizes disruption for the sending clinician while allowing the fax receiver, lots of times the acute care side, to incrementally adopt the new platform. So that was interesting. Again, this article caught my eyes, and in fact, actually at eHealth, I connected with Amplify Care and the author of this article. So probably later on in the summertime, we'll meet up and talk about the project that they did for this study. So the discussion today with Ryan and with Roger is really about why are we still faxing in Canadian healthcare, and who are they? Why everyone wants to axe a fax, right? Is fax is also being teased in the digital health circle as the blocker for innovation. Again, I will ask Roger and Ryan: is axing the fax realistic today? Is ripping out completely less efficient than upgrading it? We'll talk about AI extraction of data and that data transformation into FHIR standard. And we'll spend a little bit of time about the practical real-life example that we learned from New Brunswick and in Ontario of transforming fax-based referrals. Short conclusion, and then we'll open up for Q&A. So let's get started on who are still faxing in Canadian healthcare. So I'm sure majority of the people attending this webinar, one way or the other, you have to deal with fax every day. So basically, today from primary care to acute care, they can fax, they can print, they can send a digital referral if that's available. So what we see is majority of the referral are from primary care to acute care to long-term care. So of course, Ocean, the digital referral system is out there. I think they are in 4 provinces already and gaining momentum. And for prescription, of course, there's lots of factors there. We do know that we are talking about, close to 100 million pages of prescription across Canada every year. And of course, there's prescribed IT. But of course, I put an extra there, of course, for some of you that know Canada Health Info, we just X prescribe it as well. And then, of course, there's lab requisition. That represents a big chunk of the fax usage in healthcare today. And again, we do not touch on the reporting side, and there's still some fax traffic there. But the way I look at it is they are moving more towards a digital platform like the Health Report Manager in Ontario, Accelerus, and so on. So the first question I would open up to Ryan first. Why do you think everyone wants to ax a fax? And then, do you think axing the fax is realistic in the near term?
Yeah, it's a good question. I think there's a real dichotomy for anyone who works in the healthcare system in Canada. You see, advanced MRI imaging with AI built into it. We have robot surgery, the amazing laparoscopic surgery, the advanced testing we can do with labs. All of these, cutting edge technologies that are in our healthcare system are, built on a foundation of fax. And so that dichotomy of this archaic technology, when every other segment of the economy and healthcare is moving forward, but we're still stuck. We're anchored to this archaic way of communicating basic referrals from primary care and specialists. And so I think it's, as healthcare, you see advances in all other areas of like, how can this still be here? How can this still underpin so much of the work we do for incoming referrals that we haven't figured out a better way? So I think it's just it's a blemish on the healthcare, if we want to call it industry, to still have this archaic technology. But to your second question, there's a reason why fax won't die. There's a really good reason, because the logistics of removing it from our workflow begs the question, well, what do you replace it with? And is there something better? And when I say better, I don't mean from a technological, it's, got all these things built in. I mean, better from a productivity standpoint, because if you're a primary care provider, you don't care how fancy this new e-referral solution might be. If it's going to take me one more second of time to send the referral, then, there's going to be real hesitation for adoption from primary care. And so I think that puts pressure on a primary care industry. One of the sessions I sat in was, burnout in primary care at the eHealth conference. And so one more burden, one more change, is that enough to make someone say, if I'm going to be forced to do this, I'm done, right? Pack up my bag, I'm retiring, and 3,000 people are without a family doctor. So I think putting that pressure on primary care to adopt a system that is not necessarily going to make them more productive or efficient, those are some of the concerns. And so I like to joke, we'll take anything referral. If it's written on a napkin, as long as it's got all the information we need, we'll take that into our imaging department and we'll run with it. So that's really the limitation. It's the long tail of that adoption, and it's those systems needing to be built around primary care, being able to efficiently send those referrals to wherever they might need to go.
Okay. And Roger, what's your take on this?
Yeah, I think when the term ax a fax, or the idea to ax a fax came out in 2023, I think it makes sense, right? Because the fax has carry a connotation of inefficient, paper-based, very ineffective. I think these are the negative connotation associated to the fax. But in my view, it's not just about the paper. It's just not about the inefficiency. It is also a roadblock to automate or optimize your workflow. Because when it's paper-based, when it's image-based, it's difficult to automate it further downstream. So that's why there's such a motivation to exit. On the other hand, why it's not dying? Because for the sender, they don't see a problem. I just put it in the fax machine, it goes. They don't particularly care about what the complexity or the human labor required to process the fax downstream. So I think, yeah, that's why it lasts. And also we understand from Ontario, there, as you mentioned, there's ocean for electronic referral. The adoption is difficult. At this time, I think the adoption rate is less than 10% in Ontario, and it could be even smaller in some other province, maybe in New Brunswick. But we understand the adoption rate is really low. The original idea to axe the fax in 5 years, right now the trajectory doesn't support it. So I think we need to look at alternatives.
Yeah, and I want to make a distinction as well, gentlemen, that when we talk about fax, there is the traditional paper fax, right? A fax machine, a fax that spit out a piece of paper from the multifunctional devices. So basically, I think when we talk about fax, we are generally we are definitely against paper fax. Let's put it this way. We are all for a digital faxing infrastructure. Again, I'm sure in the audience there are investment in people system like OpenText, WriteFax, any cloud fax solutions. So anything that are electronic based faxing. So the family doctor are sending out a referral through the eFax services from Oscar, from Akuro, from TELUS, right? So that is again the faxing that we're talking about today, not just paper-based, not about paper-based faxing.
Right. I want to add to that as well. Because these days there are adoptions of electronic fax or cloud-based faxes, right? The hospital do not receive paper anymore. They receive the fax through via email. So it does help with the scalability. It does help with improving the efficiency a little bit, but it really doesn't help automate the backend process and the workflow. You're just turning a paper inbox into an electronic inbox. It's not really a real solution. So we need to do better. And I think the AI opened up a new opportunity to make it better. And also with the traditional so-called OCR-based data extraction with the electronic fax, it's very difficult to maintain as well. It's not adaptive to changes of the form layout. You need to train the OCR template or the form template from time to time. It's not efficient. But the AI, I guess the new era of AI, they are very good with language. It opens up a new opportunity in processing fax-based document more efficiently, and also potentially support more automated workflow.
Yeah, and I'd echo Roger's comments. Sitting on the receiving end of those requests, there's a big difference between receiving something that's handwritten and you're kind of trying to see what exactly this says versus the providers who are providing us with electronically completed referral forms. It comes in, everything's typed, patient demographics are typed, the clinical history. There's no trying to figure out what's actually said here. So yeah, having those come in a digital format makes a big difference on the receiving end of things.
Perfect. Well, thank you, gentlemen. So I think the ripping it out technically, from what I know working with you, Ryan, right? Today in New Brunswick, when the EMR penetration is not very high, right? It's not like in the 95% plus. So like ripping out the fax system right now, as I say, what are we going to replace it with, right? That almost is not a solution. And again, we'll talk about your experience in Horizon, because what we have done right together is that we are actually addressing it in the back end rather than the front end. So we kind of leave the primary care alone, but we did a whole bunch of automation in your side of the business, right?
Yeah, exactly. Yeah, we know that adoption is about 50% of EMRs within the province of New Brunswick. So we're dealing with half of our primary care providers not using an EMR. The tail of that group, how long it would take to actually transition them and to remove fax, it's what are you replacing it with? And so very quickly it becomes a non-starter.
Okay. So the next discussion point is more towards Roger, who's our VP of Solutions. So I know you mentioned it is not OCR. So a lot of people know about OCR, optical character recognition, able to extract the data from a scan images from a fax, eFax documents from a TIFF or from a PDF. So basically, the discussion I want to have is again, let's start with the AI ability to extract unstructured data and turn it into structured formats such as HL7 and FHIR. And then basically, what does it really mean, right? When we can do that. So, Roger,
Yeah.
are we there yet in terms of that converting unstructured to structured processing?
But I think everyone will notice the AI technology progressed so fast in the past few years. When it comes to data extraction or transcribing using this automated method, the technology also advanced very quickly as well. In fact, when it comes to the more traditional OCR-based technology, we had that like 10, 20 years ago. In fact, we have quite a lot of, we started working with hospital using the so-called conventional OCR method quite many years ago. But this method tends to be very inefficient and inaccurate. It's very sensitive to format change, the layout change, and hospital has so many forms, and whenever you change the form, the layout, you have to retrain it. So it's very cumbersome. Even with the introduction of the AI, Microsoft has a technology called form recognizer or the intelligent document processor. Even with that, it does require some training. But the new agentic AI or the large language model, being very good with language, it opens up an opportunity for AI to transcribe the data without extensive training, maybe with a little bit of training, but without extensive training. That actually makes the solution a lot more sustainable, maintainable, and scalable. Because we are working with hospitals who transcribe more than just imaging diagnostic. They're transcribing all the referrals with like at least 1 million documents a year. So imagine each document has to be retrained from time to time. That's difficult. But with the new agentic AI, it is able to understand the document, transcribe it into a structured content, and we structured it in the way to conform to the FHIR standard, because the FHIR standard it groups groups information into logical formats such as a patient record, a service request, provider information. They're already well structured, so we can package this information from a form into our industry standard, which is the FHIR format. It opens up a lot of opportunity for workflow automation and a lot to mention the interoperability. I'll draw on the word interoperability. This term becomes very popular in the past few years. But in fact, when I joined the Tech Nation Interoperability Committee, we all recognize that this term is kind of misused in a way, because the term is actually a capability instead of a strategy. It is a capability to achieve certain result, and the result you're looking for is to be able to share healthcare information securely and easily across a diverse systems or regions. That is the ultimate goal: be able to share medical record or healthcare record across systems or across boundaries. That's the objectives. It has nothing to do with fax or FHIR. Now, with the AI able to turn a fax document into a structured content, now we are able to make it easier to send this digital content across different systems, therefore achieving interoperability. But I think that's the nutshell. That's how I see it. The opportunity that AI presents today.
Thank you, Roger. And I can tell that, Ryan, even though your province, New Brunswick, is deciding on their CIS future, I am pretty sure like FHIR will be kind of the standard as well. So having a system that are FHIR compatible, meaning we can actually plug into whatever CIS system that New Brunswick are picking, and then be able to exchange any data from what we get from today from faxes, right? Without doing a lot of work, and then basically now the data can flow into the new clinical information system in New Brunswick.
Absolutely, and that data flow is key to some of the productivity gains we're hoping with the adoption of a CIS for the province, replacing those 8 separate systems. Data is siloed. You make an update in one system, and there are so many. Forget the Meditex and all scripts that we have, but all the other countervailing systems with out-of-date information, provider registries, patient registries. It's all siloed, and it's a huge manual burden of us sitting at keyboards and making changes. And the reality is that those changes just aren't happening. And so our data is inconsistent across all of these different systems. So the sooner we get to that level of interoperability where when I make a change in my scheduling system in Miramichi, that's going to update all systems across the province connected with it. So that's the end goal.
Yep. Thank you, Ryan. So I know Roger can go really, really deep into the FHIR standard and how we convert those unstructured data into the FHIR HL7 standard. Feel free to reach out afterwards. I have our contact information, so you can, if you guys want to talk, have a tech talk with Roger, feel free to do that. But I want to move on to real life example. So basically, I have the fortunate opportunity to work with Ryan and Zachary, who's a chief digital officer at New Brunswick, right, for the diagnostic imaging project. We are about to expand shortly, right, into the French side with Vitality. So I'm going to pass it to Ryan, right? As I said, they are still dealing with faxes. We convert all the paper faxes into e-fax, and then we put in this really intelligent fax processing workflow platform at Horizon. So I am going to ask Ryan to just share his experience about that transition. So Ryan, go ahead.
Sure. So this is a project that I've been working on for a number of years. Like anyone in a healthcare setting, you set out you want to do something. It takes a long time in healthcare to actually hit the ground running. So this has been years in the making, but I'm the director for one of the 4 zones in Horizon. So we have multiple modalities: MRI, CT, ultrasound, mammo, X-ray, bone density, radiofluoroscopy. So we have all of these modalities, and we receive about 70,000 requests per year. And as Daniel said, it's mainly been fax. The odd physician mails us their requests, but it's mainly all driven by fax machines. And for a relatively small department, we had fax machines in every corner of the place, faxes coming in, filing cabinets holding requests. And if you've worked in a hospital, the booking office in a paper-based environment, it's a different world. A lot of people know where it is, but couldn't tell you where to find anything unless you're working in there, and don't touch anything because it'll get out of place. And a good booking clerk is worth their weight in gold, who's very organized with all of their paper. And so wanting to push forward and transform the way we do care, knowing how inefficient and how much of a time waste a lot of the paper-based processes are, lost requisitions. We set out to digitize as Daniel said, the back end of the process. So for primary care, when we flipped the switch last July, it was no different. They're still faxing on their end as if they're always faxing. But we started receiving requests digitally. It was a change, not so much the technology. The technology was great. It was that learning curve for our staff who were, didn't love the paper system, but it was familiar. It was comfortable. It's all they've known. It's the only way we've ever done this. So, we have booking clerks with 45 years of experience. Their first job was changing lines manually when they joined the hospital. And when we started talking about going paperless, they said would never see it in their lifetime, would never see it. But working with Process Fusion, the PF360 solution, the way it was promised to us was that it was a platform that was completely customized to our workflow. And I said, sounds great. I didn't quite believe Daniel at the time, but truly the Process Fusion solution to these digital referrals coming in was built based on our workflow and did allow us to add in and customize the solution that fit our needs rather than the other way around. We didn't have to learn new terminology. It wasn't here's the box and you have to get within it. It really was customized to the workflow for New Brunswick medical imaging. To date, we've done 125,000 requests. We're coming up on 1 year since we've gone digital. We started with the one site here in Miramichi, where I live. We're now at 5 sites, and by the end of the year, we should be at 19 of our imaging locations. Like I said, no disruption to primary care, no extra time on their end to complete a request. We've automated it on our end. We can find a request out of that 800,000 total when we get there by searching a name, a Medicare number. Regular updates. I had mentioned earlier frustration at the conference of systems being stuck the way they were when they were installed. Changes, even as we went live with the system, I know changes were being made on the fly to meet that workflow. Oh, we didn't anticipate this, and a change was made that allowed us to keep flowing. Changes now happen on a monthly basis to the system, so we put those requests in, and we see those regular changes to the system to continue to meet our needs. From our perspective, no one wants to go back to paper. That clerk who has 45 years, she's retiring at the end of August, and now I never want to go back to paper because she can find every rec in a second. She's not searching through a filing cabinet. She's not searching through a shredder bin or calling someone to find that rec. Everything is at her fingertips, and everyone has that visibility into the system. So I could talk a really long time on this, Daniel. It's changed our workflow completely, but in the best way. The change is hard. It's not the technology, it's the workflow and understanding you don't have the sheets anymore. It's all digital. And as our staff have gotten through that change and now are comfortable using the system, we're a faster, more efficient, capable department as a result.
Well, thank you, Ron, for sharing. So what we are seeing also is by leaving the primary care alone or let them adopt the digital referral system at their own pace, we able to achieve automation and productivity gain in the back end without truly dragging them into the equation at the onset, right? At the onset. So with that, with New Brunswick, I know, Roger, you are very much involved with right now with another project with Department of Health, which is the Ocean project over there. So maybe I have one slide. You maybe can talk a little bit about what you are seeing in work dealing with New Brunswick as well.
Certainly. Well, before I talk about the electronic or the Ocean integration, I want to add more to the existing build in Horizon. What we have done with the Horizon Health is not just about turning a paper fax into electronic fax. The system actually has to provide a workflow automation, as Brian said, right? When we receive the document, we check for duplication, we check for incompleteness, we can support communication, fax back and forth. All these are built in with the proper cover sheet, things like that, right? So we still we can support a more efficient communication via fax with the requester. We are traditional conventional fax, right? So it's the automation, it's the communication management, it is the validation logics. They are all adding up to the value, besides just turning a paper into electronics. So that's what we have done with Horizon, and we're doing this for other provinces as well, including Ontario. For Horizon, they are also using our system to do protocol coding as well and keeping track of the schedule. So they are more than just looking at the fax, but also the RED actually looking at the fax and do the protocol coding on the systems. Regarding the Ocean integration, Ocean is a great platform for submitting referral and managing the referral at the primary care. We are working with New Brunswick right now to integrate our platform with Ocean so that our platform will be the core, they call it the MI system, core system for the managing medical imaging team. But also when the primary care or the physician submit the referral through Ocean, it will come to our system. So effectively, our system will be able to receive both fax and electronic referral from Ocean. And they all come to the same inbox. They will be processed using the similar, if not the same, workflow to achieve to minimize any change management impact per se. So this is work in progress with the government of New Brunswick at this time.
Okay, Thank you, Roger. Now, I just the marketing just flagged me that we are running out of time. So basically, for Ontario, we'll skip Ontario. Again, we are more than happy to talk to anyone that want to. We can share our insight. We started the whole journey with Mackenzie Health. We can more than happy to share with you our experience with them. So let's jump into a conclusion. So basically, we talked about fax today. We're not talking about the paper fax. We're talking about the digital e-fax, and then by automating the processing of those e-fax, we could basically turn it into an interoperable information that can be used in the downstream workflow process. So I want to ask Ryan, right, for the people that's spending half an hour with us, what's your advice or any conclusion you want to share with them, any insight you want to share with them?
Sure. Digital divide you talked about, Daniel. It reminds me of if you've ever been to London on the tubes, you'll know the phrase "mind the gap." Mind the gap, right? When you're getting on that train, watch the gap between the platform. And there is that gap between incoming digital solutions fully connected to referral management systems, and we can't, in the short term, build solutions that leave behind those still using traditional means of sending referrals. For us, the change, as I mentioned, is less the technology. Whatever solution you might be looking to adopt, it's really getting people used to that workflow. But having a partner that understands your needs and is able to build in components that didn't exist, understanding the need. Daniel, something I didn't mention, we delayed our go live by about a month as we realized to be a truly paperless solution, we didn't want to be printing requisitions out and then scanning them to put them into packs as our paper workflow was. So you had worked in your team to ensure that completely seamless, paperless. There is no paper printed whatsoever. For us, a requisition comes in electronic, it's protocoled electronically, it's scheduled electronically, we register the patient electronically, the technologist completes their comments, forms that the patient has to fill out are electronic, and that all gets sent to PACS. There is no paper made used in the making of that medical exam. So for those looking at this transition, you can certainly wait for bigger solutions, but for our team, having made the jump, not impacting primary care, but getting used to working in a fully digital environment, whatever changes come for New Brunswick in the future with a one CIS, e-referral with Ocean coming on later, we're already in a position to receive those changes and not burden our staff with too much change. We're out of the paper world, so we're ready to take it digitally, whichever way they come in. And if those are steps that you can take, I'd suggest not waiting. That clerk who's worked for 45 years, she said, I was told we'd be paperless in 1991 when Meditech was adopted. And she's like, it never happened, and didn't believe that it was going to happen this time. And I said, well, we're going to do it or die trying. And it was a journey, it was a change. We continue to roll out the solution, and we see promising results as we expand to our other areas. It does work. It is possible. And it positions you to put your team doing higher value work than searching through shredder bins, looking for a piece of paper for hours, right? They're doing more meaningful work and not wasting time. And that's the key. They say, I like it better. And for me, that translates into they've got to feel faster. Like that's the unspoken thing. They're getting their work done. They're more efficient. And they know they're getting their work done in a digital format that's faster for them. So don't be afraid. It's a lot of work, but it's definitely worth it.
Thank you, Ryan. And then Roger, for you to wrap up.
All right. Well, Brian, I think New Brunswick, you took the lead to transform in New Brunswick into digital, so-called adopting electronic fax and automation. On the other hand, I have been hearing from many leaders in other provinces, the healthcare organization, they are waiting for the regional authority to lead on the digital referral initiative, and they're just waiting, hoping someday or soon everything will be digital. They don't have to do anything about the fact. The reality is, even with the health authority coming down with the electronic referral solution, you still need fax. There's still modalities, or there's still programs submitting through fax alone. So there's really no need to wait. In the interest of automating or saving time and money for the organization, look for a solution that can help you transition from fax solutions to electronic solution easily. Don't just invest in a solution to turn paper fax into electronic fax. Invest a solution that can turn the paper fax into electronic fax, into workflow automation, and eventually into electronic referral as well. So that will give you a smooth transition when digital referral comes on in the near future. There'll be no waste in the technology infrastructure investment, and at the same time, you're not just solving the inbox problem, you're solving the workflow problem within the organization. So that would be something that we would like to encourage organizations to look into.
Okay, thank you, Roger. I think we are right on time. So we are open up for any questions. So there's a Q&A box that you can enter any questions. And then for anyone that want to see this central intake or fax processing solution live, you can visit us at proudfuture.com, or you can connect us on LinkedIn. I just checked Ryan's LinkedIn is available. Easily you can find Ryan Dugan. You can connect with him as well. And I'm sure he was more than happy to share his insight with you as well on the New Brunswick experience. So let me check.
There's a question from Rishi.
There's
a question to Ryan to confirm the examples from Horizon Health specifically for DI-related referrals only, and it's the Process Fusion solution live across all your hospital sites. So Ryan?
Yeah, thanks for the question. So right now it is DI-related rollout only, but the organization, because PF360 is really that platformed, customized workflow, we're looking at it for all parts of the organization that have paper coming in. That's lab, surgical services, our provincial heart center, accounts payable, anything where paper is coming in and someone has to touch it physically and move it through. The PF360 solution can be adapted for each of those different departments through the organization. And right now, all hospital sites. No, so right now we're live in 5 of our, let's say, 19 locations. So we started with one site where I'm located. We stayed as a pilot site. We normalized the solution and the workflows. And then this spring, we started rolling out our other sites. And I think we're doing a cadence of one every couple of weeks. So by the end of the year, we're hoping to have all 19 of our provincial, our regional Horizon imaging locations live with the system.
Yeah, so I would add to Rishi a question as well. So the goal is to the next phase of that is central intake cross all sites. So cross-site referral, cross-zone referral, and then of course cross RHA referral. That was something that actually Roger and I are working on right now with Ocean as well. So basically, this is all diagnostic imaging with Ryan right now, but the next project, the program that we are working on that across the both regional health authority is actually the MB Heart Center. So that will be a program that will be truly central intake for all New Brunswick, and I think it actually includes PEI as well. That's what I was told. Also, thank you for the question and thank you for the answer, Ryan. So I saw also a question from Zach. Is the eFax study available publicly? Yes, it is. It is actually a public. They publish it to allow everyone to download and see. Amplified care EFAC study. I think you can probably Google it and find that study and download it. And then the same question. The question is, does the central intake solution only support digital intake? Of course, it is no. Again, based on what we have seen so far, to go to 100% pure digital is ideal, but it's not realistic in the short term. There's a lot of moving part for the whole system, from the referring physician to the intake side to be 100% digital. That still requires some work. So in our opinion, right, the faxing and the e-faxing will be part of the system for at least a little longer. I don't know how long, but it will be here for a little bit.
And Daniel, to echo that, I had mentioned earlier receiving requests by mail. So we've been digital for just about a year now. We still have a couple of primary care providers who mail us requests for imaging. We receive them in the mail, and we have a process where we put them on one of our Lexmark multifunction printer scanners. We scan them. They get digitized and scanned and sent into PF360. So even though we're still physically receiving in the mail paper referrals, we digitize those on our end so that all imaging referrals we have are processed electronically.
Thank you. So thank you for your time, Ryan. Thank you, Roger, for your time as well. And thank you for those who spend 30 minutes with us or 40 minutes with us and learn about what we are seeing in the industry. I'm again glad to hear that the publication from Amplified Care kind of validate our viewpoint as well. So thank you everyone for joining us. Again, our contact information is there. Feel free to reach out to us at any time. And with that, I'm closing the webinar. Thank you very much, Ryan. Thank you very much, Roger, and everyone joining us today. Thank you.
My pleasure. Thank you.
Thanks so much.
Bye.
Bye-bye.